the organizations they represent, as well as the services those organizations provide to folks in our community. And then at 11, we'll have a chance to speak directly with these representatives. We'll give everyone attending here access to jump into different breakout rooms that the representatives will be in, and you'll have a chance to ask them questions directly if you want to learn more specific details before we close out at the end of the day. Very quickly, just want to give a special thanks to the resource team for getting this event set up from the bottom. Also want to thank the representatives that are here today for giving their Saturday mornings to speak on the organizations that they represent. And we also want to thank Dr. Tam Villar, who we will go ahead and transition into the next slide. Dr. Tam Villar is a professor in residence over at UNLV. She got her PhD in psychology, and correct me if I'm wrong, Dr. Villar, she has been in clinical counseling for quite a few years now, about 15 plus years now. And we'll go ahead and give her the floor to speak a little bit on the impact of COVID-19 on mental health here in Las Vegas.
Thank you very much, Justin. Thank you for the introduction and for having me here. Good morning or afternoon, depending where you are. Everyone, it's wonderful. It's wonderful to see everyone here coming here with an interest for mental health care. Again, my name is Tam Villar, as Justin introduced me. I use she, her, and hers pronouns. I am an assistant professor at UNLV in the College of Education, and my research interest has been in the realm of mental wellness, self-compassion, and addictions treatment. So aside from being an academic, I'm also a licensed clinician in the state of Nevada. I've been a licensed clinician for 15, 16 years or more. My treatment specialty is co-occurring disorders, specifically working with the population of clients, the psychological trauma and addictions. So it's a pleasure to be here and share a few words, actually maybe more than a few words, to highlight the effects of COVID-19 on our community members' mental health. So my hope here is to be able to convey the importance of prioritizing mental health. So what I will be talking about today are the things you already know. So I will attempt to respond to the who, what, how, and when questions as they relate to the pandemic. As we all have been through the pandemic since March 2020, we all have seen, heard, and perhaps experienced the effects of COVID-19 on our mental well-being. Everyone and everywhere in the world has been affected by COVID to varying degrees. Go ahead, next slide, Justin. There we go. So, but on a micro level, looking at Clark County alone, Clark County population it's roughly around 2 million people. And as of today, perhaps, there has been around 250,000 people or cases of COVID in just Southern Nevada. Directly or indirectly, COVID has affected our frontline professionals, medical healthcare professionals, business owners, all types of workers, students, families, individuals, and practically anyone. The pandemic has brought calamitous changes to all. Right? So on the next slide, we have a list of the different changes, and this list is not exhaustive. I'm sure I probably have missed at least a few. So that the pandemic has changed our daily structure, routine, schedule, our ways of connecting and communicating with others, our loved ones. We have had to learn quickly to adapt and function Restrictions in traveling has also made it challenging for many people, many professionals. Physical activities might have drastically decreased or increased for some people, depending on access or means and motivation during the pandemic. COVID has forced schools and colleges to find different ways to disseminate information to students, and students find themselves with changes in learning routines, habits, and academic performance. The pandemic has certainly led to major changes in the way we work. We have frontline professionals or essential workers having to work probably 100 times harder to serve, support, or treat others while keeping themselves and their loved ones safe. We know of individuals working from home while tending to their children, engaging in remote learning, and the stress that comes with such arrangement. We know of individuals who have lost employment or changed their employment status due to the pandemic. All of these changes related to work have probably happened to some, if not all of us, ourselves here today. So COVID's restrictions also has changed the way families could grieve the loss of their loved ones. Not being able to be there to say the final goodbye or to a loved one or have a proper funeral for a loved one, it's a great sorrow that I just cannot imagine. During COVID, with many changes in a person's routine, work, school responsibilities, finance, spiritual practices, perhaps, sense of safety, self-care tasks such as nutrition management and sleep hygiene have also changed, and possibly not for the better for many who are deeply or heavily affected by the pandemic. COVID has brought great uncertainty to many, not all, and undoubtedly has affected everyone's mental well-being to some degree. Nonetheless, despite all these extraordinary changes, I would also say that COVID inexplicably has also brought few opportunities, which I would touch on briefly later on. So as a helping professional, as a licensed therapist, I have met with patients struggling with a myriad of challenges pre-COVID as well as during COVID. So I guess I can share, while maintaining confidentiality, of course, a couple clinical cases here to highlight the effects of COVID. Just a few months ago, I met with a client who's a parent of 2 young children under the age of 5. We're seeking professional counseling for depression. They reported depressive symptoms such as crying spells, debilitating feelings of hopelessness. This individual used to be able to regulate emotions or feelings and had experienced situational depression, not clinical, before, whereas they were able to shake it off and refocus on work. Recently, they lost their father during COVID, not due to COVID. They were unable to provide a proper funeral for their dad due to the restrictions at the time. And a couple months later, they had to move to Las Vegas from California for work. During the pandemic, they contracted COVID, lost a temporary job. They were asymptomatic. They started to lose self-confidence. They started to experience high anxiety, self-doubt. They had self-doubts. They feel isolated during the pandemic, during the quarantine, self-quarantine. and eventually leading to deep feelings of depression and thoughts of suicide. They also started drinking, using alcohol more with isolation. And their spouse just wants them to get over it, to get over depression quickly, to be able to be there for the family, to provide for the family. They suffer from low self-esteem and helplessness since they're not contributing to the family. So now they're in treatment, they're seeking treatment, and they actually feel guilty and selfish for getting treatment because they believe that they should be there for the children instead of sitting in therapy sessions. However, fortunately, they are working hard to try understanding and accepting that it is important to be away temporarily for treatment to get better, so they can be there and be more present for the children. Now, more recently, actually this week, I met with a 14-year-old patient admitted to inpatient for a suicidal attempt. This adolescent patient shared that since COVID and having to attend school virtually, they experienced more tension and frequent arguments at home, and their grades suffer greatly. They actually said to me, school is like a little break from home, and I like to interact with the teachers, talking with my friends. Now I don't have that, right? It's often. So for this patient, COVID exacerbated their existing mental health conditions, leading to that point of great distress. And then there were some that returned to unhealthy ways of coping with the stress of COVID. I had one patient said, during quarantine, I broke down, I smoked again, after 2 years of not smoking. And then another said, I was sober for the longest time of my life until COVID hit. So those are just a few cases there. And besides these few cases where COVID has not only brought on pain and distress, COVID also in particular has exacerbated anti-Asian racism and increased hate crimes. We know May is Mental Health Awareness Month, and May is also Asian American Pacific Islander Heritage Month. Asian Americans are not impervious to mental health challenges. So as a person of Asian descent, I can't help but wanted to also acknowledge the reality of the emotional burden COVID has had on the AAPI community. Go ahead head on to the next slide. So directly or indirectly, knowingly or unknowingly, COVID has affected many areas of a person's well-being. Physically, one may experience low energy, all kinds of aches and pains, fatigue, and perhaps from becoming more sedentary with changes in daily activities and routines. Mentally, people may engage in self-defeating thoughts, negative thoughts about themselves and others or the world. Thinking the world is not safe and dangerous, especially when we're constantly bombarded by sad and bad news. Emotionally, one may feel feelings of sadness, anger, fear, guilt, numbness, perhaps, etc., from the drastic changes, perhaps from the blames, the restrictions, grief, all types of loss, many more factors related to COVID. Some people may be able to express their emotions more freely than some others, and some may not be able to identify or feel specific emotions due to various and complex reasons. However, I think it's helpful to remember that we were all born with emotions for good reasons, right? We were wired with emotions consisting of what? Sadness, anger, joy, shame, guilt, fear as part of our survival, protection, and growth. So I would say it is okay. It's not, if not instinctive actually, to feel however we feel. It's okay to feel our feelings, and hopefully to find safe ways to process and work through these feelings. Now, socially, spiritually, one may engage or re-engage in isolation, especially with the COVID social distancing directives. So one may experience the loss of direction, meaning, or purpose with the losses during COVID, and having little control and a sense of community. Oftentimes, many of these psychological or mental health effects are invisible. They are experienced as invisible wounds and suffering. Their effects, however, are no different from physical injuries, if not more painful to bear, especially when that pain is not shared. So no one has to bear their pain alone. So go ahead on with the next slide. So when you or your loved ones are withdrawing from things and people, especially when it is safe to connect and engage in healthy activities now, when you're feeling lonely, even in the company of others, feeling lost, feeling angered easily, hopeless, helpless, or experiencing crying spells, feeling exhausted, unmotivated, discouraged, numb, trapped, or stuck, it's imperative that you or your loved ones seek professional help. If you or your loved ones struggle with focusing, concentrating, or staying on task for the majority of time, and experiencing high anxiety, depression, deep, dark depression, suicidal ideations, please reach out. And request professional support, services, assistance. Also, when you or your loved ones engage in ineffective coping mechanisms such as self-injurious behavior, self-harm behavior, using drugs, alcohol, and when coping on your own and alone is not sufficient, seek professional help. I would like to note that when we engage in maladaptive coping, it is not because we are bad. I want to make sure that that's stated there. It makes sense, if not instinctive, for us to want to get rid of discomfort or unpleasant emotions. However, it can be unsafe, unhelpful with the ways and the means that we use to cope. Reaching out to whether advisors, coaches, teachers, friends, peers, professionals, mental health services can help us discover or rediscover self-compassion. Self-compassion can help us free ourselves, liberate ourselves from self-imposed perfection, and give our suffering a voice. So reaching out gives us the wisdom in knowing what we can and cannot control. Professional support and services may help us learn to build healthy relationships and connections, acquire healthy stress management through nutrition management, time management, boundary settings, and many more safe coping skills. With professional help, we may also learn and realize the importance of medication management if that is part of our treatment. It certainly is not an easy task. to ask for help because perhaps the stigma or ego and pride that may get in the way. It may help to remember that we have the right to communicate our needs and seek and request mental health services. Most importantly, I think, I believe that reaching out for help in itself is an act of resilience. Reaching out is one of the best self-care exercises that we can practice. We engage in self-care because not because we are selfish. Actually, when we engage in self-care, we actually care about how our being and doing can be of the best help to others. Excuse me. So to wrap up, I hope I did not go over too much time there, Justin. So I'm going to wrap up, right? So to wrap up my portion for the day, I would like to balance the effects of the pandemic on mental health with a reframe in a way. COVID certainly has brought many devastating effects. And I think it would be fair and perhaps helpful to also recognize how it has brought a few opportunities. As I previously briefly mentioned, I think it has showed us how resilient we can be. It has generated creativity by changing the way we think and solve challenging problems. I think it has elicited flexibility in the face of uncertainty. It has perhaps helped keep us grounded with humility and gratitude toward the technologies we have here, perhaps the new connections that we might have made otherwise, and the humanity among those who have helped and advocated for us. So with that, I'd like to thank you all. Thank you for giving me the opportunity to share my passion for mental health care with you today. And have a great rest of this virtual fair.
Awesome. Thank you, Dr. Villar. That was very insightful. And it actually touches on a point of the reason we did this fair was to, connect folks with the organizations that provide the services that you're speaking about. If you want to ask for help, we're hoping to use this fair as a chance for folks out there to learn about the organizations that they can ask for help from. And we also want to show that, with COVID and with creativity that comes with it virtually or using these virtual platforms is another way that, we're learning how we can connect folks with these services for mental health. So without further ado, I'd like to welcome Nicole, or let Nicole Vaughn take the stage for Changing My Psychiatry. And we're gonna go through the different organizations that we can all speak upon. So Nicole, go ahead and take it away.
Hello, and thank you for having me. So yes, I am I guess you want to say founder, the person that decided I branched off from a traditional psychiatrist clinic, and I opened up a nurse practitioner owned and operated clinic that's grown to be pretty significant for the mental health community. So the main gist, I guess I would say, is that we provide outpatient psychiatric services. We provide medication management. We provide psychotherapy. We're now getting ready to introduce TMS therapy. We are essentially a private practice clinic. Just because initially when we first started getting things going, it was just a lot easier. We are trying to branch out to become more of a community mental health, where we're able to actually provide services to patients that are uninsured or underinsured, and basically be able to accept everybody. But basically we are, like it says on the slide, we're a group of mental health nurse practitioners. We are all board certified in psychiatry. and we all practice completely independent of a psychiatrist. I know that's new to a lot of people in the community. In 2014, the nurse practitioner groups got together and went to, the governor and got the approvals and whatnot for us to be able to practice completely independent. And a lot of people are kind of thrown off by that, seeing the nurse behind it, but we prescribe just like a psychiatrist. I would say we probably add the benefit of having that psychotherapy training in order to integrate that in with our patients during the sessions. We serve everyone from about the age of 6 on up. We do have a couple kids that are a little younger, 4 that are in just psychotherapy, but we do see ages 6 and up with medication needs. We do a lot of work with the hospitals. We get a lot of discharging from the hospital. Our goal is obviously to prevent readmission. It's kind of a cycle thing with, I think with the hospitals and the outpatients. We want to prevent hospitalizations because we know that hospitalizations actually cause worsening symptoms and worsening outcome, because those exacerbations definitely cause more trauma to the brain. But so we try to work it, to prevent those. And like I said, we do a plethora of different, we have about 15 therapists on board with us. So we have specialties from grief to trauma, lots of trauma. We've got a lot of play therapy. We've got PTSD therapy. We've got some therapists that do EMDR. So we try to bring a lot of different, I guess, niches with each of the therapists. We definitely, we've got a couple of our NPs do some of the hormone replacement therapy for patients coming from the LGBTQ populations and whatnot. So we do just a lot of really anything that we can get our hands on and provide. We try to do that. Services that we don't provide in office, because we are not that community mental health and we are not that provider 14 behavioral health company, but we do refer out to, because we work pretty closely with a couple behavioral health companies that are, really legitimate and do provide those services, but we send them out for BST, PSR, housing. We've got some housing resources and just transportation. So when we get patients in, we don't case manage, but we do, in the sense that you have a patient in front of you that needs services, we make sure that they get done. And so as nurses, I think we're all nurses first, and we learn to be super resourceful with little resources. We have a job we have to get done. We may not have all the resources, but we kind of pull things together and get it done. So that's kind of where we're at, and we're just trying to grow and put, make our mark into this community.
Perfect. Thank you so much, Nicole. We'll go ahead and move on to Desert Parkway. Kyle Dunlap was unfortunately unable to make it on time. He might be able to join us later, so we'll revisit these slides a little bit later today. Just to speak a little bit on Desert Parkway, they provide both inpatient and outpatient services to adolescents and above, but hopefully we'll have Kyle join us a little bit later to give us the details. So with that being said, we'll go ahead and move on to Amy. Amy is the Director of Business Development over at Seven Hills Hospital. So go ahead and take it away, Amy.
All right. Thanks, Justin. Thanks so much. Thanks to all of you for inviting Seven Hills to be a part of this important discussion today. I really enjoyed Dr. Villar's talk, and also the optimistic note at the end there about the opportunities that we have. The biggest opportunity I see is that mental health it's a topic now that people are talking about. They're talking about it in the media. We're talking about it at homes with families. And I think that really helps people to understand that there's a wide spectrum of need out there, and there's resources out there in this community to help people no matter what their needs are. Seven Hills Hospital is a psychiatric facility. We're one of a handful that specialize in crisis stabilization and detox. Most of the folks in this room are going to know what that means. The people that come to us are in danger, they're in crisis, and we stabilize them for usually a couple of days to sometimes up to a couple of weeks, and then put them on a path of sustained treatment, either through our outpatient services through a referral to another provider here in town, depending on their needs. We have 134 beds. We work both inpatient and outpatient here on this campus. I'll just point out a couple of things that are unique to our program because I think that's going to be most useful here. We do have an addictionologist here. Dr. Al-Sheikh is board certified in psychiatry and addictionology. He is the medical director of our opiate treatment program. One thing that's unique, we have the only licensed opiate treatment program located within a psych facility in the state of Nevada. So we're very proud of the work that we do there and some of the outcomes that we have in our opiate treatment program. We are able to maintain and taper Suboxone and methadone here. And we also allow smoking here, which is something that is important because a lot of people don't want to come into detox. They don't want to get treatment because they don't want to have to give up their nicotine, which is understandable. So that's just something to remember if you run into folks who are looking for detox treatment, addiction treatment, that's kind of, I guess, a perk that we offer here. We also have a dedicated geriatric unit. We have RNs and CNAs who are able to work with slightly more medically complex patients here. So that's important to know if you're dealing with an older population. We also work inpatient with children as young as 5. That seems awfully young to have an inpatient experience, and it certainly is. We're very conservative when it comes to admitting kids that little, but it is at times necessary for the safety of the child or others around them. So please keep that in mind if you're working with anyone who is dealing with a little there. Our outpatient program, we have 2 tracks, one for mental health, one for substance use. Some unique aspects about that. We do have an evening substance use or CDIOP program, really designed for your higher functioning working adults. Those folks who are getting up and going to work every day, but they need someplace to go in the evening just to try to maintain their sobriety. That's been the one big need that we've seen since COVID hit is some of those people who, as Dr. Villar mentioned, they've had sobriety for years, but this amount of stress is it's got them right on the edge. So we're offering that program to give people some support in those vulnerable evening hours after work. We also have our adolescent PHP program as well. That begins at 2 in the afternoon. We can offer transportation to bring kids to our facility, pick them up at school if they're back on campus, or at their home if they're attending online programming as well. So those are just a couple of the highlights from us. Happy to be here again. Feel free to reach out anytime. Feel free to reach out to me if you'd ever like to get together and we can compare our programs to the providers here, and certainly to the attendees who are joining. If you have any questions, we're open 24 hours a day, 7 days a week. You can call us. We can give you a good deal of information over the phone and even do a teleassessment over the phone if that's needed. So thank you, Justin, very much. I don't want to hog up too much time. Carry on.
Perfect. Thank you so much, Amy. And you actually brought up a good point. We'll provide contact information for everyone that is present. So if you do have any further questions after this event, and for folks who aren't able to make it but are watching this recording, you can reach out that way. So we'll go ahead and move right along to, we have 2 representatives for Solutions of Change. We have Alex and Crystal, who will go ahead and speak on their organizations.
Okay. Hello, everyone. Thank you so much for joining us, and thank you for having us here. So Solutions of Change is a nonprofit organization that we just kind of started. So we provide services for youth, families, adults who are either uninsured, underinsured, and by underinsured, we mean like limitations, maybe co-payments are too high, or they've tried to find other organizations who take their insurance and just can't find it, and also undocumented individuals. So what we do is we provide free therapy services and as well as case management, which is Alexandria. She's our family specialist, family service specialist who assists with any case management if we need to, any resources. We do also have some programs that we have been starting. It will be on the right, and Alex will go ahead and further just go with that. We do provide in-person and we do provide telehealth services at the moment. So if you have anyone you'd like to refer to who can afford these services or needs it or just need someone, some assistance, it doesn't necessarily need to be just therapy. If they just need resources, you can definitely contact us for help. And I'll pass it on to Al.
Thank you, Crystal, and thank you, Justin, again for having us. Crystal's the intake specialist, and I am the family service specialist. A couple of the programs that we do have going on right now would be Fancy Friday, which was actually created during the pandemic to get people to just kind of dress up and feel good about the day themselves. And that's done on YouTube. We do it the second Friday of every month. And we also offer a youth trauma support group called WTF, or What the Feelings, and that's for ages 12 to 17. That youth group will be bi-weekly every other Friday from 4:30 to 5:30 p.m. and that is with our licensed intern. And then we recently started Solutions of Change's monthly mental health moment, and that's to bring mental health education over a variety of topics to family. Doesn't really matter the age. So our first program that we have is called Emotional Intelligence, and that's kind of just going to teach about emotions and how to handle those in the world. We also will eventually offer like Family Thrival and just a lot of things to kind of help with the total mental health wellness. And then for me, I am the family services specialist, so I help with resourcing and also all wraparound services. So I'm going to make sure that outside of your therapy, that everything else that you need is handled so that you can, get that obtain mental wellness. So thank you again for having us, and have a good day.
Perfect. Thank you, you too. And I forgot to include, there is a save the date for Solutions of Change that I will add to out email after this event. So there's a conference that is going to go on with Solutions of Change. So let's go ahead and move right along to Jasmine, who will speak on behalf of the Pavilion over at Southern Hills Hospital.
Hi, good afternoon, everyone. Thank you guys for having me. So yes, Jasmine Smith. I'm the Director of Physician and Provider Relations at the Pavilion at Southern Hills Hospital, and I also serve as the co-vice president on the board for Nami Southern Nevada. So we do appreciate all of you taking time on a Saturday. While it's still windy, it's still sunny. So that's we just appreciate you guys taking time to be here. And so the Pavilion at Southern Hills Hospital, so we are HCA, so we are actually sister facilities with Sunrise and Mountain View Hospital. And so as you can see kind of the picture on the top left, we are attached to a hospital. And so I would say that's one of the greatest highlights of our facility. So say a patient comes in and they need a cardiac consult, say we have a pregnant patient, guess what? We have a 24-hour laborist just that can walk right on over. Any labs or imaging that needs to be taken, those services all come over to us on the behavioral health side. So we do have 80 beds. You can see it's 45,000 square feet. It's a huge building, but with our different courtyards, we actually have natural lighting throughout the building. So very pretty, very uplifting and sunny as you walk throughout the facility. I've also included some pictures for you guys on the left-hand side. But so we have an adolescent unit for ages 12 to 17. We have 2 adult units, and then we have a geropsych unit. And the geropsych really is more of our more medically complex unit. So on that unit, there's a dedicated geriatrician, but we also have PT, OT, I mean, you name it, different services that come over. We have a tub assist room. We also have CNAs working on that unit so that just, for those more medically complex patient cases, we put, say we had a patient that recently delivered. So we did have a postpartum mom on the unit just because, she might need a little bit more support and staffing. We also have IOP. So we have a teen and an adult track. Both of our programs are primary mental health. So secondary really can be just about anything, but primary will be mental health issues. Our IOP attendees, our participants are welcome to join either in person or virtually, depending on their comfort level. One thing I'd like to highlight, we recently, a few months ago, we started a support group. It's called Teen Talk, and we've had really great success. It's a free program for students aged 12 to 17. It's absolutely free, and the group is facilitated by our outpatient adolescent therapist, Olivia. She's an LCSW. She does a great job connecting with the students and the families. It's just really a forum where the students get together and they can talk about anything they want. But it's been going really well. So feel free to reach out to me if you guys have any questions about that. Also, Electroconvulsive Therapy, or ECT. So we're the only provider in the state of Nevada, and this is just a treatment modality for anyone that's chronically depressed, anyone suffering from mania or even catatonia. And we've had some really, really amazing success stories with that program. And so actually, on a side note, we also have an event, an ECT today, debunking the myths and fears that come with the stigma around, shock therapy. And so that's going to be on June 2nd. And our ECT psychiatrist will be giving that talk. We have CMEs as well as CEUs available. So I'll be sure to push that flyer out to the group once I get everyone's contact. And yeah, that's kind of us in a nutshell. If you guys have any questions or need any other information, feel free to reach out to me. Thank you, Justin.
Thank you so much, Jasmine. We'll go ahead and move on then to the Southern Nevada Adult Mental Health Services with Tiffany, or SNAMS for short. Go ahead and take it away, Tiffany.
Hello, everyone. Thank you guys for being here. So my name is Tiffany Beard, and I work for the state. I'm with Southern Nevada Adult Mental Health. So we provide outpatient services, case management, therapy. So I'm over all of the clinics here in Las Vegas, also Laughlin and Mesquite. So I'm the clinical program manager too for the agency. We have our West Charleston clinic, our East clinic, and we have a satellite office inside Department of Welfare in Henderson. We have our Rawsonville Psych Hospital, and we have our Stein Hospital/jail. So that's where our clients who are maybe on trial or trying to see if they, can stand trial, they would go there until transfer back to CCDC. But we have AOT, which is the assistant outpatient treatment. We have regular traditional. We have our PAC team, which are more intense clients with mental illnesses or who may suffer from like sexual crimes, things of that nature. We have our SOT team, which is the supportive outpatient treatment. Oh, you can change over, Justin, to the next slide, please. There we go. So you guys can see all of the services, and then it explains what each service does. So again, we are a state clinic, so we only take fee-for-service Medicare. Now, if there's a situation, if we have someone come in, say they're in an emergency situation, and they need assistance and their insurance just started, because with Medicaid, as we all know, they have different parts. So you may have HPN or, Anthem, different ones. So if you come in and you're in a situation, we will see you, but we'll let you know, hey, we'll get you started to make sure you're stable, and then you have to transfer over. But we also have a mobile crisis team that goes out in the community, to get like homeless clients or people in shelters or things of that nature who don't know about our services to receive mental health services. So with that, it's kind of an overall, because we do provide many services and also in the community. So our transitional and traditional teams, those are clients who can manage themselves in the community, but need a little bit of assistance. So with that, we work on like med management, longer term goals of being stable. We have supportive systems and things like that, just kind of keep them going in the community, because we have found that we have a lot of people who have mental illness. They can manage themselves, but they don't have a strong support system. So if we're in and we're assisting, our case management team will, see them once a week or once a month, depending on the need of that client. But it kind of stops the recidivism of people just going to the hospital because they need people to talk to, or, because they need people around them. So those are the services that we provide. We also have a residential team where we house clients in group homes. Some are CBLA, some are intensive. It just depends again on the client's need. But our whole goal, of course, is to be a community provider, make sure that clients are stable and they can manage themselves in the community. And of course, take their medications. So, I mean, I'm always available if you guys have any questions, or if you guys have people that your agencies can't assist, or you guys can always call me. We'll see what we can do. You know, even if we get them in short term and you guys take over after that, but we're always available and we're always willing to help.
Great. Thank you so much, Tiffany.
You're welcome.
So we'll go ahead, move on to Charlotte, who will speak on Spring Mountain here in Las Vegas.
Good morning, everyone. My name is Charlotte Watkins, and I am the community liaison for Spring Mountain Treatment Center. And first, I wanted to say this is a great training. I really appreciate everyone, all of us coming out and giving this information, which is so valuable and so important. We empower individuals and we try to create solutions through proven exceptional care. We also have an intake phone number that is provided for anyone to call if you want to check on your insurance, or if you want to make sure that we have available beds. One of the fastest ways to make contact is also through me, but you can also call our 702-322-9 number. Jason, you can move to the next slide. So Spring Mountain Treatment Center has been around since 2001. It used to be the old Charter House hospital for behavioral health here in Las Vegas. We also have a location, and that's going to be located at our 5460 West Sahara location. And at that location, we have a lot of our senior population and also our IOP for our children and our teenagers. They meet at that location. But we offer a caring and healthy environment 24 hours a day, 24 hours a day, 7 days a week. We accept children 85 and above, and we also offer treatment and detox for our co-occurring substance abuse. Some of the programs that we have and how we treat some of our individuals, or individuals who are experiencing any type of depression issue, maybe depression, it might be anxiety related, it also may be psychosis, schizophrenia, bipolar, and panic disorders. We're really here trying to help our community and also provide services for our different partners, which everyone here is a partner to us. We also have been doing something a little bit different. I've been reaching out to our tribal communities, Mojave Indian Center, which is really an untapped community. They have a lot of needs, especially when you start talking about detox and alcoholism. So we work very closely with our tribal community. And then some of the other things that we do is we do have partners. We are a UHS facility, so we partner. Our sister hospitals are Spring Valley Hospital, Henderson Hospital, and Desert Springs Hospital. In our sister hospital that I just described over at Sahara, we have our children IOP, which is in the afternoon, 3 days a week. And we try to specialize in different components, make it a little bit to resolving conflict resolutions for them, managing stress, maintaining and learning eye contact because they're so busy on their phone. They're not really focusing with their teachers or even their parents, and really trying to get them to understand how that phone and in their face or on the computer really is a barrier to learning and communication. And then learning to control their emotions and behaviors. And really one of the important things is staying calm. So that program for our adolescents is for ages 12 to 17, is offered 3 days a week from 3 to 6. And then we have a children intensive IOP, which is for ages 9 to 11, also 3 days a week, and that's from 4 to 7 p.m. We also have our own telehealth services. And we just, I say about 3 months ago, we started our call us first. You can go and online and you can schedule your appointment for Spring Mountain Treatment Center. And this is a real true online scheduling. If there's availability, which most of the time it is for that day and time, you can go ahead and schedule that particular day. So we really trying to get people who need services not to wait, but to really go ahead and try to get them into our facility right then and there. And then one of the other things that I wanted to say is that we are the first corporate sponsor for Nami. So I'm very excited about that. So we want everybody else to really jump on board and get involved with Nami. It's such a great organization. And again, my name is Charlotte Watkins, and I am one of the community liaisons. And you can reach me at 702-349-2186. And I'm available to answer any of your questions. Thank you.
Thanks, Charlotte, and we really appreciate the plug there. The very last but not least, we'll have Dr. Moiring speak on the VA, Southern Nevada healthcare system. So go ahead, Dr. Moiring.
Hello, can you hear me okay?
We hear you, yep.
Okay, very good, excellent. So again, my name is Dr. Moiring. I'm from the VA here in Las Vegas. And I just want to be able to give you a little bit of information on some of the programs that we have available for us. The mission of the VA has always been to, fulfill that, what President Lincoln had promised, right? To care for those who shall have borne the cost of battle, right? And we want to be able to serve the veteran. We want to serve the family as much as we can. We want to honor those individuals. So we really tried to promote this world-class benefit of services that they've, have spent anywhere from, maybe just a year or two to some cases 30, 40 years in service. And these are things that they have earned by their service. And we do adhere to some of the strongest standards of compassion, commitment, excellence, professionalism, integrity, accountability, and stewardship across the board. So that, that we really work on the I care principle in terms of working with all of our veterans. So some of the programs that we do have available, so we do have primary care mental health integration. So that is just integrating mental health within our primary care teams. And that is generally quite often the first introduction to mental health within the VA. It comes from their primary care doctors. So we do have these integrated teams that work very closely with the primary care providers and all the other specialties that are in that primary care team, such as nursing, pharmacy, social work services, dietitian, those kinds of programs as well. And they can be seen pretty much on the same day. They can get seen on the same day they come in for their primary care appointment, or they can just walk in to the clinic, any one of the 4 outlining clinics around the valley or the main hospital. And of course, they can also go to the clinic in Pahrump or down in Laughlin as well and get seen on that day. And so they're within the primary care mental integration, they're going to be seen for 4 to 6 sessions. Generally, those are the mild to moderate type cases. We do have the addictive disorder treatment. We have all stages of that. So if they come in, they need detox, we will get them detox in our crisis stabilization unit that we call 2 East. But we also have a residential program. We have the intensive outpatient program, and then the traditional outpatient as well, and then aftercare for that. So we can take care of the addictive disorders, and that could be anything from a substance to we have sex addiction, people with gambling problems as well. So any of those addictions things. We have the post-traumatic stress disorder program. That program is purely an evidence-based program. We do have individual and group therapies through that. Again, they're completely evidence-based, so very heavy in terms of using CPT or PE. A lot of ACT-D as well within that program, a lot of mindfulness things within the PTSD program itself. Our behavioral health interdisciplinary program, we refer to it as BHIP, the acronym. That is a team that is made up of psychiatrists, psychologists, social workers, nurse practitioners, or physician assistants who specialize in psychiatric treatment, as well as our peer support specialists who work on that team, and then nursing for the care management side of things. We do have couples and family services available to them as well, so we can work with the veteran and their spouse or significant other. If they've got children and they want to, be able to engage in some family therapy, with the kids, we have that available as well. We do have a pretty robust military sexual trauma, or MST, availability in terms of treatment. So whether that is for if they have PTSD from the MST, or if they have depression or other anxiety type disorders, whatever that's related to the MST, then we have those services that are available to them. We have specialized groups for MST survivors. We have men group and women's group that goes along with that. One of the things that I absolutely love that is not seen nearly enough, in my opinion, is we do have Alpha Stim. So those of you who are not familiar with the Alpha Stim, it's a medical device that we can use that treats depression, anxiety, insomnia, and pain. And it treats all four of those actually statistically better than medications that treat those four things. And it's very, very popular with our veterans. And so we can actually teach them how to use it, get them using it, and then we will actually issue them one of those devices as well. So that's one of the things that we have that's really exciting at the VA. We do have TMS available as well. That's for treating that treatment-resistant depression. For that, we have again our crisis stabilization unit. On board. We have mental health pharmacy that works with our teams. So we have pharmacists that specialize in psychiatric care, and they actually will help in terms of being able to monitor and manage some of those more complex cases with medications. Neuropsychology for any neuropsych testing, rehabilitative type services as well through neuropsychology. Suicide prevention, very robust suicide prevention program. In fact, we just are in the process actually of hiring somebody that's going to work suicide prevention with all of our community partners. So don't be surprised if all of you out here that are community partners with the VA, that you'll be seeing somebody come around relatively soon, specifically to work with you. We look forward to having that person join us probably in the next month or two. We do provide intensive case management as well, psychosocial rehab with our SMI type population as well. Vocational rehabilitation services, very heavy with that. They also work with our residential addiction program with it. A huge shout out to all of our peer support providers that we have. Right now, I think in the VA, we're upwards of around 25 peer support specialists that work either in behavioral health or with our social work service as well in our HUD-VASH community. They do a phenomenal job of working with veterans and helping them around navigate the VA system and things that we do offer as well. And then most recently, we just opened up our esketamine clinic. So we do have esketamine up and running I think about 2 or 3 weeks ago that started in terms of running. So and that again is for those treatment-resistant depression veterans that we have. So those are just kind of some of the things we have. And I appreciate everybody's time and attention. Thank you very much.
Perfect. Thank you, Dr. Moyring. So our last segment of this event is going to be kind of a chance to give folks who have been listening here an opportunity to speak directly with the representatives. So in just a second, we're going to go ahead and send the representatives that have just spoken into a breakout room. And we will also give each of you access to jump from room to room. I really encourage everyone here to ask questions, to learn more. If you want to get contact for one of these organizations, this is your opportunity to do so. And really to just learn more about if something stuck out with you about one of the services that they provide, or for one of the facilities that you want to learn more about. This is your opportunity to learn more about that as well. So we'll go ahead and send the organization reps into the breakout rooms now.
Sorry, Justin, just real quick question. So after the breakout rooms, will everyone be reconvening back in the room, or is there a certain time that they will end at?
Correct, yeah. So we'll send out a notice that around 11:45, we'll have everyone come back to the main room here, and then we'll reconvene.
All right, well, thank you so much everyone for your time. I'm gonna be hopping off now, and please ask questions and connect with those organizations that presented such great information for us and are doing great work in the community. Thank you, everyone.
Mm-hmm. Thank you, Trin. And lastly, this was just kind of a smattering, a smorgasbord of the organizations that represent our community. So, if you want to learn more, this is the chance to do so. So go ahead. We went ahead and sent folks into their organizational rooms here. If you can go to the next slide, please. There we go. So in order to go into the rooms, there should be a button at the bottom of your screens. If you are on a computer, you just have to hit the button that says breakout there. And you can choose the name of the organization that you want to learn more about. The representative will be in that room. If you're on a mobile device, whether it's on a phone or an iPad or something, you can see on the right there. You just have to click on the breakout room and then hit join. So without further ado, go ahead and use this opportunity to ask the questions. You can jump from room to room. And if you have any questions about going from room to room, let myself or Janelle know. We'll be in this room to answer any questions you have. Thanks, Angel. And if you things can be and how difficult it might be to find the organizations that provide services, mental health services here in Nevada. We do plan on making this a recurring thing so that we'll have plenty of opportunities in the future to learn more about the different organizations that are here in Nevada. Thank you again for making it. We'll have the recording either sent out via email so that you'll have access to the whole event, at least the presentation part of the event. We'll also send out the contact information for the folks that were here that spoke on behalf of the organizations. And we'll send that to you by email or put it on Nami of Southern Nevada's website. If any of you have any questions at all about the proceedings of the event, or if you would like to get in contact with Nami proper, you can always reach out to me. I'll send out the email to you so you can reach out to me, or you can reach out to info@namisouthernevada.org, which will also be an email. So without further ado, thank you for being present today. And we look forward to having all of you present at future events as well. So thank you.
Thank you, Justin. Thanks, Tren.
Thank you, Justin. Bye,
Justin.
guys.
Thank you. Have a good rest of your weekend.
Thanks so
Thank
much. Have a
you.
great weekend.